Hi, everyone. Thank you so much for joining me on the fourth episode of COVID Recovery Series, where I speak with patients who have recovered from the coronavirus, who will share their inspiring stories, but also movers and shakers from all over the world who are fighting this fight. Now, tonight we are going to Miami, a city loved by so many people worldwide that unfortunately is the hardest hit city in the state of Florida. Now, we are going to speak with the mayor of Miami, who himself tested positive. He'll be joining me from Miami and sharing with us his story of recovery, leadership, and what he is doing for this beloved city. Mayor Francis Suarez will be joining us now. So let's see where he is. Oh, there he is. Let's bring the mayor in. Okay. Hi, Mayor.
How are you?
Hi. How are you?
How's it going?
Good, good. Thanks so much for joining us. I know you're
You're very
very
welcome.
busy and, lots are going on in Miami, but I think viewers from around the world would love to hear from you, especially since you yourself tested positive. But how are you doing now?
I'm doing great. I spent 18 days in isolation here at home. Uh, got to do a lot of Facebook Lives and interviews from different parts of my house. Got to know parts of my house that I didn't quite know very well. But the hardest part obviously was being away from my wife, my two children. I have a 6-year-old and a 2-year-old. But because of the virtuality of our world now, and especially since this pandemic began, we have found ways to communicate that were available, but maybe we didn't take advantage of before. And it allowed me to be productive, to stay engaged, and to stay busy, which helped me, not worry too much and about my illness.
Right. Now you were asymptomatic. That means you didn't show symptoms. You tested twice. For people at home who may not have access to testing, what's your recommendation to them? What does this tell us about the importance of staying home and really respecting, the social distancing and so forth?
Well, what we know, what all the experts have said, is that the only way you can contract it, this is a highly contagious disease, is if you are in close contact with someone who has it. And so the safest thing that you can do is to avoid that. Obviously, we've implemented strict orders to stay at home unless you're doing something exceptional. Implemented a curfew. We've implemented rules. If you're going to an essential place like a supermarket, you have to wear a face covering. So we try to do everything we can from the city's perspective to guide people and really make it a requirement that people implement these guidelines so that they not only don't infect themselves, but don't infect others as well.
That's an important point. And Mayor, I really want to focus on hopeful stories. And a lot of people are having a lot of anxiety and feeling the day-to-day challenge with this pandemic. Now, in Miami right now, what's the situation with this sort of lockdown? What can you tell people who want to go back to the norm, who are anxious to get out there, but don't know what to do? What's going on right now in your city?
So, and we just literally got off a call right now, as you mentioned before, where we were talking about that. So, the way we're going to do it is similar to what the plan that the president has laid out, which is a three-phase plan. And each phase is 14 days. The issue that we have is when do we begin phase one? And phase one requires a sustained reduction in new cases, a sustained reduction in symptomatic, reporting, and also a reduced or a sufficient hospital capacity. So that has to all be analyzed and certified. And we're asking the Department of Health from the state of Florida to give us a certification that we have met phase one based on the data they're looking at. And then based on that, we'll have a very limited amount of things that will be opened with still some more restrictions and so on and so forth. But it's going to be a data-based approach. We're hoping to unveil it tomorrow. And so that will it'll give very, very specific detail on what will be open, how it will be open, at what capacity it will be open. But there are some things that, irrespective of what is opened, we're going to be with for the foreseeable future. A lot of
Mhm.
things having to do with social distancing, a lot of things having to do with facial coverings. They're going to be with us for a while, even as we relax some of the other standards.
Right. I think this is a question that's on a lot of people's minds. Are the beaches in Miami going to be open?
So from everything that I have gathered, the answer is no. At least not for the foreseeable future. Unfortunately, we saw what happened at Jacksonville when they opened the beaches. People just flooded the
Yeah.
beaches. A lot of it is not. We don't want to close things unnecessarily. The problem is it's very difficult to police certain
Right.
things. And so the
Right.
issue
Right.
for us is not so much whether we open or close them, it's how do we enforce it if people are not following the rules. And we've seen, unfortunately, too many circumstances under which the minute we start relaxing things, people just sort of take advantage of it, and don't respect some of the other rules that we have in place, such as social distancing rules. So that is the big concern that we have.
Right, and I think given that you went yourself through this illness, you're such a uh, authentic leader, essentially, to talk about this because you experienced this, and people would trust you more in leading the way. Now, coming back to your own testing, after you recovered, you tested negative, meaning that you were COVID free, and then
Right.
what did you do? You wanted to donate plasma.
Right.
Tell us about that because myself, I recovered from COVID about 2.5 weeks ago, and I want to donate. I'm in Europe. I'm not sure if I have access to
Right.
the healthcare that I need here to do that. But in any
Right.
case, I think a lot of people want to do that.
Right.
What's the process right now in Miami for those who want to give back?
So what I did was I had to follow a very strict regimen based on there are two ways to get out of quarantine, right? One of them is a testing protocol, and one of them is a not testing protocol. And I would urge you to go on the CDC's website, and you can see both the testing and the non-testing protocol. We decided for me, since I'm the mayor and I'm usually in contact with so many people, to go through the testing protocol. So I had to test twice negative in a 24-hour period. Once I did that, not only do we have that evidence that I've passed the testing protocol, but I was eligible to donate plasma, and I just felt obligated to donate my plasma, and I want to continue to do that to help others who may be in a much more critical state than I was. I was very fortunate. I was very blessed, as you said, I was fairly asymptomatic throughout the entire process. So, if for
Incredible.
those of you, yeah, I think I'm very lucky. So, for those of you who are considering donating plasma, I would tell you to reach out to One Blood, which is the company that I used, and I would also, if you're a recipient, if you're someone who's looking to receive a plasma donation, I would urge you to talk to your hospital, have them contact One Blood as well, because it's a fairly new procedure, and we were trying to get the hospitals accustomed to it as well. And even the president mentioned, a convalescent plasma donation in his last address, where he talked about, opening up the country.
I see. So it's an ongoing process that people have to go to the website that you mentioned and also CDC that would direct them in Miami.
Correct.
Okay.
Yes.
Um, I, I want to focus, as you know, I interview folks in different cities. I want to focus on what good stuff are happening in Miami. Unfortunately, there are a lot of homeless people, as are in other major cities. What can you tell us about some policies or immediate plans that your city has put in place to help the homeless community in these tiring times, Mayor?
And we're very blessed. We actually, for a major city, don't have a lot of homeless. We have about 750 or so. We have a very tight census on our homeless population, and we are constantly interacting with them. They're people that for whatever reason decided they want to be homeless. We try to provide them services. We're testing their temperature. If they're symptomatic, we're testing them. We are if they're test positive, we're putting them in shelter. We obviously have portable hand sanitizing stations that are at their disposal. So it's just tough because the homeless population in Miami is essentially, we're down to the chronically homeless. There are people that essentially want to be homeless. A lot of them have codependencies, whether it's drugs or mental health issues. And some of them don't. Some of them I've met with them. I've spoken to them. Some of them just they enjoy being that way. And those are the toughest ones because it's hard to convince someone who wants to be
Mm,
homeless not to be homeless.
mm, I see. But the city's not forgetting about them at this
Oh
time.
no, no, we're very we were just actually we just got out of a federal order, which was passed in the 1980s because of how compassionate we are with the homeless. We do everything that we can to try to give them an opportunity to bounce back and to succeed. And we're always trying to find new ways. I'm actually going to be sponsoring something in hopefully the next commission meeting where we're going to be giving $25,000. I'm going to be giving $25,000. One of our other commissioners is going to be doing that as well, and we have another matching grant to do a rental program for them so that they can find housing if they need it.
Oh, fantastic. That's great. I want to take a step back. Policymakers, politicians, leaders tend to have a busy life, right? And I think the coronavirus pandemic is one of those rare and humbling times in our world where everybody's united one way or another. It doesn't matter. It doesn't matter if you're the president or a shopkeeper or a teacher or whoever. We're all in this together. And I want to focus on gratitude, Mayor. What were some of the things that went on in your mind when you were at home? You mentioned you miss your two kids and wife. Tell me about those humbling moments. What did you think about? What went on in your head? You weren't running around. You weren't in the office. What was
Yeah.
going on?
So, I mean, first of all, it was very difficult because when you're running a city of this size and you're making decisions that affect people's lives, you want to make sure you make the right ones. And so it's scary sometimes. Obviously, you have to make some tough choices. I mean, I had to obviously cancel large events, and that affected a lot of people, hundreds of thousands of people. But it also could have saved lives. And so that's what you're balancing. You understand that every decision that you make has it's two sides of a coin. On the one hand, you're trying to protect the health and safety of your residents, and on the other side, you're impacting people's lives economically. And so, what I've tried to do from the beginning is err on the side of protecting people's health and welfare, because my perspective is that if people get sick at an alarmingly high rate, like we've seen in New York and in Italy and in Spain, then your economy is going to come to a grinding halt regardless. And so, for me, it's always been about, allowing the data, the medical experts to drive my decision making. And that's how we're going to be making our decisions going forward as well in terms of determining whether or not anything gets reopened.
I see. What are you grateful for most right now?
I'm grateful for the time that I get to spend with my family. I can tell you, I just went today for a bike ride with my son. Just being able to spend time with them. I have a pool in my house to be able to spend time with them here. The fact that we have a tremendous, I think the virtuality, and I don't think it's totally sunk in, that we have almost transported most, if not all, of our business onto a virtual platform. And so that I can be here with you on Instagram Live, and the minute I shut off with you, I can walk to where my son is doing a project right now for school, and then my daughter who's sleeping, in her crib. So you're never disconnected from your family, and I think I really think that it's I think it's important for us to understand what is most important, what is basic in our lives. And one of the positive things that have happened through this pandemic is I think we've gotten closer to each other and gotten closer to our families.
I see. No, that's very true. I think mayors in particular have a very intimate and close relationship with citizens. What is your message to other mayors around the world, cities that have been hit hard, but also
Yeah.
cities that are in the safe zone? What do you say from the heart as someone who has gone through the illness and is leading the way?
We've been talking to all of them. I mean, we have a great, sort of companionship of mayors through the U.S. Conference of Mayors. I talk regularly. I've been talking regularly with the mayor of New York, the mayor of Los Angeles, the mayor of Dallas, the mayor of Austin, the mayor of Rochester Hills, who's the president of the U.S. Conference of Mayors. I mean, we've been talking. We have a leadership committee, and I think first thing that we do is we support each other, irrespective of party. We communicate information and give each other information, and we share orders. When we put out an order, sometimes a mayor will ask me, "Hey, we would like to see a copy of your order so we can imitate it." We also have I talk to the mayors in the state. We have something called the Florida Urban Partnership. So it's Miami, Jacksonville, Tampa, Orlando, Fort Lauderdale, St. Pete. We talk amongst ourselves. And then we have the Miami-Dade League of Cities. I used to be the president of that organization. And we talk among the 34 cities in Dade County. So we're in constant communication with each other, informing each other, keeping each other upbeat, sharing information and decisions.
Absolutely. I think it's an important time to, forget about the politics and really come together. What do you say to Americans right now as we're going through this tough time? What is your message of hope, really? Because I think more than ever, we need unity. As this mayor of one of the most beloved cities in the States, what's your message of unity right now?
My first message would be that we have to hang in there a little bit longer. That we have to be disciplined just for just a little bit longer, that we are seeing a light at the end of the tunnel. We're seeing our cases go down in a sustained way since we implemented some of these measures, and that we're going to bounce back. We are a very resilient country. We're very made up of very resilient cities, and we're going to bounce back, and we're going to learn from this. We're going to be stronger as a result. And I think, we have, as cities, we've been focusing on, and even as a federal government, we've been focusing on a set of threats, whether it's a terrorist event, whether it's a shooting, threat, which is a biological threat. And I think after this, we're going to be more prepared than ever to handle it. And I think that's a positive.
Excellent. Well, I'm really happy that you recovered, your family is safe, and I hope that everyone in Miami and in the entire United States will fight through and we'll get back on our feet soon. Thank you
Absolutely.
so much, Mayor
Thank
Suarez.
you so much. A wonderful time.
Thank you.